It's really great to talk to you today, Professor Greaves, about your career. And I think we'll just start really by asking you to tell us what your role and subspecialty in the field of hematology has been.
Okay, well, thank you, Vivian, and thank you for being here to ask me these questions. So I trained in general internal medicine as well as clinical haematology. My training was in Sheffield and then Aberdeen and Melbourne for a couple of years. And I moved to Aberdeen to a professorial post in haematology after that. I then moved also into university management. And I would say I've been very fortunate in having a career that spans clinical medicine, research, teaching and managerial roles, and I've thoroughly enjoyed that career.
Who or what really sparked your interest in hematology and inspired your career choice?
I really feel quite strongly about the importance of role models, and I was very lucky to have such role models in my very first appointment as a house officer in general medicine for 6 months in Sheffield. I joined a team led by a gastroenterologist, Derek Holsworth, but haematology units were not necessarily discrete at that time, and this general medical ward had a small cohort of haematology beds, and the lead was a charismatic haematologist called Professor Eddie Blackburn. And I remember Eddie in his office on his desk had a monocular microscope, a brass one I think, with a light source of a bulb in a cut down coffee tin, and he made these fantastic diagnoses, morphological diagnoses using that, he appeared to. And I was supported by him and his team, Eric Preston, John Lilliman, David Winfield and others, and also by Harold Swan, who taught me the rudiments of morphology. All of these people had their own eminent careers in haematology, and I benefited from that, from their enthusiasm. And also John Ward, who was a diabetologist who helped me a lot with the clinical medicine aspects.
Did you feel that the things that first sparked your interest in hematology in the long term and long run really turned out to be good reasons for going into hematology?
They did. I don't think you can beat experience. You could argue it was the first clinical specialty that I became aware of, but I was just so taken by the idea of combining the laboratory aspects with the clinical aspects that it certainly fulfilled all of what I could have expected. And I also got encouragement in terms of how to approach laboratory haematology training, which is challenging, and also how to approach the College of Pathologists exam, which at the time was neither objective nor structured, although it's much better now.
It certainly is. And what do you consider to be your greatest moment or perhaps moments in your career?
I think, Vivian, moments is the right question, because I've got more satisfaction from daily interaction with patients and trying to assist them with their health problems, and particularly that haematology laboratory to bedside approach. That's been hugely satisfying for me, as well as working in a team. I suppose I got satisfaction from passing the College of Physicians exam after thinking I got most of the diagnoses wrong, and even more so the College of Pathologists exam, in which I did really badly in the serology component, managed to, I think, bail myself out in the oral examination. I was lucky with those things. Perhaps more seriously, I was very proud to be asked to be president of the British Society for Haematology in 2001. Prior to that, the Scottish Society of Haematology in 1999, and because of my particular interests, the British Society for Hemostasis and Thrombosis, I was happy to be president of that in 2003. All of those are regarded as highlights. I think some of those things also helped me in relation to academic medicine to take on additional roles in university management, which again I found very rewarding, and I don't think could have arisen without that background in clinical academia. So I became the head of the medical school here in Aberdeen and subsequently head of College of Life Sciences and Medicine, and learned a lot in terms of people management, I guess, through those appointments as well.
So as you said, wow, a lot of great moments. Which aspects of hematology would you say have given you perhaps the greatest satisfaction?
I think, Vivian, that is working as part of a team. with consultant colleagues, with nurses and specialist nurses, other allied health professionals, and I'd particularly mention diagnostic laboratory scientists on whom we have and continue to rely and who show their great skills in relation to quality assurance and dedication and productivity. I think it's that team approach. All of those people and others contribute to clinical care. And I've been very lucky with my consultant colleagues in Aberdeen. So 4 others joined me at the same time in Aberdeen in 1996. Henry Watson, Dominic Culligan, Jane Ty, Mark Vickers. And they've helped me enormously just in interacting with them on particular clinical problems, gaining from their own experience, and also supporting me in a way that allowed me to undertake these other activities around medical education and around research. So I've benefited more than anything else from teamwork, and that's really been a highlight for me.
Fantastic. And in terms of looking over the past few decades, what would you say are some of the key innovations and achievements in hematology over the last 60 years?
It's a lot of decades, but yeah, I was there, so for most of it anyway. So I guess a good way to answer that is to think back to my first appointment again. So thinking about the haematology patients I saw, there were very few chemotherapeutic agents available. Supportive treatments were pretty non-existent. I was expected to do manual coagulation tests, I don't know about those, Klein-Hauer tests. Imaging was plain x-rays and maybe angiograms. Ultrasound was not well developed. Blood products were not well developed, so I think concentrates became available in the late 1960s, so home treatment of haemophilia was only just coming in. Really, we were working in a completely different environment in terms of what was available and what is available now. Certainly there was no human genome sequencing at that time, of course. And now we have fantastic imaging, we have very evidence-based treatment regimens, fantastic supportive treatments. So things have moved on hugely over those decades, and I've been fortunate to see a lot of that.
And so you've mentioned a lot of great innovations and achievements that we've had to date. Looking ahead, what would you say are perhaps the remaining unknowns?
So a good example might be one of the holy grails in hemostasis, as you know, is can we develop an antithrombotic, an anticoagulant that doesn't cause increased bleeding? The answer so far is no, but I don't think that's hopeless for various reasons. That would be one real issue that has to be solved, but there are many others. If you just look in PubMed for TTP, you'll find over 100 references already in 2019, even more for immune thrombocytopenia, indicating very clearly we still need to know more about the biology of these diseases and how they're best managed. And I could name others, but there's still plenty of unanswered questions in hemostasis and thrombosis.
Absolutely. And looking at what's happening just now, what would you say are some of the most significant developments just now in our field?
Okay, I've been retired for a few years now, but I've watched with interest, and particularly in my latter years in clinical practice, I think the introduction of the direct-acting oral anticoagulants has been a very significant advance. So of course before then, warfarin was really the only useful oral anticoagulants, with all of its problems around dose response and bleeding problems and the need for monitoring. It was first introduced as the ideal rat poison in 1948, the year before I was born. I don't think those two things are related. But then introduced as a human anticoagulant, an anticoagulant in humans in 1954. And it's been the only one available, as I've said, until the new anticoagulants, the direct oral anticoagulants, were introduced over the last decade or so. And I think that's been a significant advantage for a very large number of patients. So I put that high up on my list. There was some antipathy to the no monitoring initially, I remember, from colleagues, but I think that's gone away now. And again, their safety has been further enhanced with new medications to reverse their anticoagulant effect in the emergency situation. So all of that, I would say, constitutes a really major advance in hemostasis. I think gene therapy, I've alluded to already, that's a reality now in haemophilia B and increasingly in haemophilia A. Obviously we need further long-term studies, but again a major advance on the quality of life for haemophilia patients. And in other disorders there have been incremental advances. An example might be in TTP with the introduction of immunotherapy with rituximab and the potential for ADAMTS13 treatment as well in that disorder. So lots of developments, but that's just a few highlights for me.
Absolutely. You've mentioned some really great achievements that are going on just now. And what would you say are some of the challenges that we are facing in hematology currently?
As in all specialties, I think the complexities of diagnosis and treatment are increasing, maybe even increasing exponentially. And that's a challenge, keeping up to date, particularly so in smaller units where it's really not possible to subspecialise. I've been lucky in that regard. I've been able to focus down on just a relatively narrow range of diseases. For a lot of haematologists, that's not a possibility. And so because of that, I think we need to think very carefully about future training, about how we manage workloads for haematologists. I think that's one challenge. UK's probably punched above its weight in haematology research, and maybe haematology lends itself very much to clinical research because of the close links with molecular pathology and the types of disorders that lend themselves to multi-centre clinical trials to determine better treatments. That still is important and will continue to be important, but it's going to be challenged, I think, by whatever the recent political decisions turn out to be in relation to access to European funding, for example, to experts from Europe being able to work here quite easily and this being an attractive place for them as it has been. Both of those things I think are going to be crucial. It's also well demonstrated that the most impactful studies are multi-centre studies, and particularly those that are multinational multi-centre studies. And anything that has a negative impact on our ability to work with centres of excellence across Europe is going to, I fear, have a very negative effect on pursuing research in haematology. And finally, haematologists have been very good at recruiting patients into clinical trials, but also because of what I said earlier about complexity of conditions, there's less time for that now. And I think we need to think very carefully about making sure that in haematology's job plans, there is ample time for teaching and research activities, because it will be to the detriment of patient care in the long term if we can't manage that.
How would you say would be the best way to raise the profile of haematology in the next 60 years to inspire future students to specialize in our field?
Yeah. Important again. I think I'd refer back to role models. I think that is important, that medical students and junior doctors can see individuals who enthuse about and clearly enjoy pursuing their clinical specialty. There have actually been quite good studies on specialty career decision making amongst medical students and junior doctors, and amongst the factors that shine through are exposure to the specialty in the undergraduate curriculum, the ability for the student to see that they would be working as a discrete part of a team and contributing to that, patient contact, and enthusiastic teachers. All of those things I think we need to provide. I remember there was a survey recently which demonstrated that in some medical schools, haematologists have very little input into the teaching of their subject within the curriculum. Clearly, against that background, that's not a good idea. So I think we need to be promoting our specialty at the undergraduate and the junior doctor level.
What advice would you give to people considering starting a career in haematology just now? The
first thing I say to them is that I've enjoyed it hugely, And would I do it again? If you asked me that, absolutely I would. I think what I'd say to them, haematology, and I mentioned this several times, benefits from this laboratory diagnosis to patient to back to laboratory approach, which is very satisfying, I think. As I've said already, it also lends itself very well to basic research and also to clinical research, clinical trials and so on. Patient contact, working in a team, all of those things I think we can sell to make haematology as it is look very attractive to potential trainees.
So Professor Greaves, you are very clear that you would do it all over again. And so my last question to you really is, given the choice, would you prefer your career to have been in the last 60 years or in the next 60 years?
I think I'd be foolish to say the next 60 years, simply because I have gained so much from it, and maybe that wouldn't be the case going forward, I don't know. So I think I would say I prefer to have done it the way I have. If I had another 40 years of healthy life, which is not going to happen, then maybe I would certainly do it again, but I think it would look a bit different for all the reasons we've discussed. I think also I'm from the sort of background that maybe is too old now to do this well, so it'd be somebody more like you for the future. So for me, for example, Facebook is a photo album, Twitter is what you hear when you go out into the garden in the morning. I don't have those skills, you do, and so it's really an open book for you in the future how haematology goes forward.
Thank you very much for a very interesting interview and insight into both your career and haematology in the past 60 years, and as well your predictions for the future.
Thank you, Vivian.